concise talk on this topic. Next, I invite Dr. Sindhu NM, Associate Professor, GMC Ernakulam, for her talk on blunt trauma effects.
Good afternoon. Causes, effects and prognosis of blunt trauma. Blunt trauma is the most common type of injury in both adults and children. 80% of the patients with significant eye injuries comes in young adults. Workplaces is the most common site of injuries involving in production industries, construction site or transportation, farming and mining. The usual questions that an ophthalmologist has to encounter are, will I go blind or will I get my vision back? To answer that question, we have to take a detailed history to determine how, when and where the eye injury occurred. All the life-threatening injuries to be identified and to be documented. Documentation of visual acuity and ocular findings to be done after the detailed examination under slit lamp, and injuries to be classified according to Bett's classification. We know closed globe injury means the outer quarter of the eyeball is not penetrated. It's subclassified into contusion, lamellar laceration and superficial foreign body. Bett's classification is universally accepted and concise classification, but in real life, not all the injuries we cannot fit into these terminologies. So individual injuries to be addressed and identified because of most of the injuries will be mixed mechanism injuries. How to prognosticate? The initial visual acuity at the presentation points are given, and other factors like lobe rupture, endophthalmitis, perforating injury, retinitis, retinal detachment, RAPD are considered, and the total row score sum is taken and OTS score is given to it, and this will help us to give an idea about the visual acuity, chance of probability of getting visual acuity at the presentations. Injuries in blunt trauma are mainly due to coup or direct injury, or counter coup due to transmitted pressure waves to the posterior pole, or an anteroposterior compression and horizontal expansion. This anteroposterior compression can cause posterior displacement of the iris lens diaphragm, and the fluids within the eyeball will not expand, so it compress, so this expands equatorially and can cause shearing forces at the attachment leading to tears. These are the 7 rings of trauma: iris sphincter tear, iridodialysis, cyclodialysis, angle recession, trabecular meshwork tear, zonal dialysis and subluxation of the lens, and retinal dialysis tears. Going into details, the superficial foreign body, this is the most commonest presentation in the casualty, with a metallic foreign body or any foreign body impacted on the cornea or the anterior ocular surface. This metallic foreign body has to be removed under slit lamp after putting under local anesthesia with a 26 gauge needle, and antibiotics to be given to prevent infection, secondary infections. The corneal abrasions, the debridement, in discontinuity in the corneal epithelium, this will move easily visible under slit lamp and cobalt blue filtration filter. Antibiotic and cycloplegics to be given to prevent secondary infection. Osseous ring is a pigmented ring present in the anterior lens capsule due to severe anteroposterior force. It's due to a direct impact. It's a telltale sign of a blunt trauma. When you see a osseous ring under slit lamp examination, look for other traumas like angle recession or subluxation of the lens. Iris sphincter tears is common. Radial sphincter tears present in the pupillae margin. This can result in traumatic mydriasis, which may be permanent or temporary. The pupil reaction will be sluggish, or it won't react to both light and accommodation. Iridodialysis is the dehiscence of iris from the root of the iris. We will get a D-shaped pupil with a black biconvex area in the limbus. Uniocular diplopia will be present if there are the damages in the inferior nasal or temporal, and glare is the most commonest problem with iridum. Ankle recession is a tear between the circular and longitudinal muscles of the ciliary body. On gonioscopic examination, you will get a widening of the gray ciliary body band. Sometimes blood can also seen in the canal of Schlemm. Ankle recession and trabecular meshwork damage is the most commonest cause of secondary IOP increase in a trauma case. when the ciliary body separates from the ciliary spur, it's called cyclodialysis. The commonest complication of hypotony is due to passage of aqueous humor from the anterior chamber to suprachoroidal space. In a later period, due to the closure of the cleft, this can cause ocular hypertension. Zonular dialysis is secondary to tearing of the suspensory ligament. It can be partial, causing a subluxation of the lens, or total due to causing a dislocation of the lens. You will get a deep anterior chamber, iridodonesis, phacodonesis, and uniocular diplopia and a lenticular astigmatism. Retinal dialysis and tears as a desensation of the retina at the ora serrata is called dialysis. Most common site of dialysis infratemporal quadrant, but a supranasal dialysis pathognomonic of trauma will get a Schaffer's sign in the slit lamp examination. Coming to the sequelae to the blunt trauma, traumatic iritis is the most seen in 80% of the cases of trauma. This is due to trabeculitis or obstruction of the trap meshwork by the inflammatory cells. It's commonly self-limiting but may need a short therapy with topical steroids or cycloplegics. Prostaglandin usually avoided in the immediate period. Intraocular pressure should be monitored carefully and regularly following a trauma. In the initial period, the hypotony, if you get a hypotony, always exclude a occult open globe injury. The elevated IOP may be due to an angle recession, a trabecular meshwork damage, hyphema, or inflammation. Absolute bed rest for the 48 to 78 hours immediately after trauma is needed to prevent secondary bleeding, which occurs in the 1-2 days of the trauma. And medication, head end elevation with topical and systemic anti-glaucoma medications are indicated. Surgical removal of the blood occurs in uncontrolled glaucoma or a 100% persistent hyphema called 8-ball hyphema, early corneal endothelial staining, or hyphema more than 50% persisting for 14 days, or eyes with active rebleeding. 8-ball hyphema is black colored blood in the anterior chamber. It's suggestive of impaired aqueous outflow and a decreased oxygen concentration. Corneal blood staining is accompanied by a hyphema with an increased intraocular pressure and an endothelial damage. A reddish brown or greenish color which simulates a dislocation of the lenses as a clinical presentation. It takes 2 years for clearing. The traumatic cataract called rosette cataract is common. This is due to rupture of the anterior lens capsule and influx of the aqueous humor causing opacification. It can be early rosette or late rosette, which may appear even after 2 years of the after trauma. A cataract surgery may be necessary if visually significant opacity. To summarize, these are the ophthalmic effects of contusion or concussion injury, and the take-home message is foreign bodies in the eye is extremely common when you sit in the casualty. Apart from endangering the sight of the worker, there is a great economic loss due to expenditure of time and compensation. So prevention is always better, and provision of comfortable protective goggles at workplace is a must, and public health awareness sessions should be given to educate the people to protect their eye at work and play. Thank you.